Well, good afternoon. I'm Dr. Mark Freeman. I'm the new medical director for Telemedica. This month we're talking about patellofemoral pain syndrome, but I want to let you know, as of last month, we talked about chronic pain. Again, I want to reiterate, pain is one of the four manifestations of inflammation. It's a symptom, therefore it's subjective. And in this month, we're going to talk about a particular location of your pain. I do want to say that as a medical director for Telemedica, I oversee the clinical reviews. I host our telemedical team live streams. I'm providing relevant medical information for our veteran community as a subject matter expert for Telemedica. In the past, Telemedica has offered telemedicine evaluations. As a company, they're working hard to launch that service again. But in the meantime, we're offering informative resources, such as live streams, on veteran-related issues and conditions. With this information, our hope is to empower you to talk to your care provider so you can obtain a diagnosis. And with the diagnosis, Telemedica can write a nexus letter, do specialty medical documents, or can also help you with your mental health evaluations. Okay, let's moving right along to our topic for this month, which is patellofemoral pain syndrome. Well, let's give it a little overview. As the name implies, the title implies, it's first off a syndrome and not a specific disease or illness. And syndrome means a condition of said contention. Patellofemoral is the location, but pain is the idea. And so pain located in the area of the patella, which is the kneecap, and the femur, which is the bone in the thigh, which the kneecap overrides the joint of the knee, which articulates the femur, the thigh bone, with the tibia or the leg bone. And so let's go over some of the anatomy. The patella is the kneecap in layman's terms. It is overridden by the quadriceps tendon in the thigh to insert onto a major portion of a bony portion of the leg bone, are called the tibia. We call this the tibia leg bone. Okay, so this structure is supported laterally on both sides of the knee, medial and laterally, by collateral ligaments, and anteriorly and posteriorly, or in the front or in the back, by cruciate ligaments. One's called the anterior cruciate ligament, the other is the posterior cruciate ligament. So ligaments attach bone to bone, but tendons attach muscle to bone. And as we said earlier, the structure of the knee has the quadriceps tendon overriding the kneecap or the patella and inserting on the tibial tuberosity or the leg bone. Certain things underneath this structure, if you will, can occur. Mostly, we said pain, and we're going to describe some of the symptoms associated with this particular type of pain. And we know that pain is subjective, and it's certainly a manifestation of inflammation. Some of the symptoms associated specifically with patellofemoral pain syndrome is a dull, aching pain, mainly in the front of your knee, if you will. And this is usually caused by use and abuse or wear and tear for certain performances, mostly athletic, that requires increased weight bearing, increased strain or stress. And as far as particulars, doctors really aren't certain what causes, except that it can be associated with overuse, muscle imbalance or weakness, injury, such as that which occurs with trauma by ground pounding and by rucksack marching, by running up an incline or stepping downstairs. And that's another thing, squatting, and or could be injurious due to a previous fracture, or maybe some sort of surgical, post-surgical insult. Say if you had to replenish or repair an ACL tendon or ligament repair, and they used part of the tendon in the repair, it could lead to deficiencies of the quadricep tendons and or the patella tendons, which could lend to a condition of inflammation, which we know manifests as pain on a chronic use and abuse process. Okay. Let's go over some of the risk factors for developing chronic patellofemoral pain syndrome. These might be your age, which actually the younger adults are more prone to than older adults. When older adults mainly have pain in that area, it's usually due to arthritis, osteoarthritis, or what we used to call degenerative joint disease, now called osteoarthritis. It could be degenerative arthritis. So usually it's found in younger adults, mainly athletic adults. I mean, young adults. And then also sex could be a predisposing factor. Women are actually twice as likely as men to develop patellofemoral pain. And I don't know if it's not because the knee joint is not as strong with the stabilizing ligaments, and or it's more prone to inflammatory processes. Is still unknown. Certain sports can predispose you to this type of patellofemoral pain, such as participating in running and or jumping sports can put extra stresses on your knees, especially if you increase in your training level. Some of the things that we might be able to do as far as prevention, which is always my preference as a preventive medicine physician, is to maintain your strength. So in these type of athletic events that involve running and or jumping, make sure that your soft tissues are strengthened to the point where it can support your weight bearing activities. And so that's very important. Maintain strength in this area. Think about your alignment and your techniques when you're working out. If you're doing resistance training, make sure that you're let's take, for instance, you don't want to squat with weight and allow your knees to buckle in. That can cause more problems than not. It would be preferable that you have normal alignment, but if you had anything out of alignment, it would be better to have it more of a lateral malalignment than opposed to a what we call knock-kneed alignment. That's not good. Also, if you would, because it's stressful when you're ground pounding or you increase in the stress on your knee joints by running or jumping, also weight bearing events, it's probably best to help prevent this condition if you were to lose some weight, as well as if you're training and for running or jumping sports. It's always better if you warm up, increase the circulation in that area so that it's not shocked into a inflammatory, an acute inflammatory situation. Stretch before you work out. Increase your intensity of your workouts gradually, and practice shoe smarts. I mean, make sure that your shoes fit well, and if you need some shock absorption, put insoles or inserts as you need. So I think we went over a little bit about the overview of patellofemoral pain syndrome. We went over the anatomy and the physiology, or the structure and the function of the knee joint, and that which overrides from the thigh area, overriding the kneecap and inserting onto the leg area. We talked about some of the plausible causes. We don't really know specifically. That's hence why it's known as a syndrome, because it's a condition of pain due to the inflammatory manifestations. And we talked about some of the risk factors. We also talked about some prevention, how you can prevent this condition. Now, this is there's some interesting notes that go along with veteran-related conditions, which we all know that we have to march and run and rucksack and climb inclines and declines and train for all of our activities while serving. And we did that and still have some chronic pain in this area. And so some of those prevention and treatment recommendations should be followed. But this is something interesting that I found in my research for this presentation. I found from the VBA. So let me read to you from a document or an article that is pertaining to an overall pain scenario, but we're going to relate it more to this patellofemoral pain syndrome. First off, there's been a history of denial for chronic pain in the VA benefits. This long-standing VA policy goes back to a well-known 1999 case involving a veteran who's claiming service connection for neck pain. His post-service medical exam diagnosed the veteran with a, quote, history of trauma with continuing pain in the cervical spine, unquote. And this was Sanchez Benitez versus West back in 1999. At one point, the veteran underwent 2 months of treatment for his neck pain, but the VA denied coverage for the veteran's pain-related treatments after radiology exams could not find any evidence of injury or trauma that could explain the ongoing neck pain. As you may recall, to establish service connection, one needs to show, number one, an in-service event, number two, a current disability, and number three, a link between the in-service event and the current disability. In this case, the Federal Circuit Court concluded that, quote, pain alone, unquote, claim must fail where there's no sufficient factual showing that the pain derives from an in-service disease or injury. Again, this is Sanchez Benitez v. Principe, and back the Federal Circuit Court of 2001. Now, this historic decision has applied to all, quote, pain alone claims until now, and this is what I want you to realize. There's new VA rulings labeling pain as a disability. A recent Federal Circuit ruling overturned the long-established policy of denying pain alone claims for service connection. Great news for veterans suffering from chronic pain without any detectable cause. The new ruling involved a veteran of the Gulf War who served 6 years in the Army. During service, this veteran suffered a knee injury. Military doctors diagnosed the veteran with patellofemoral pain syndrome, our topic of discussion for this month. In short, they claimed as knee pain. When the veteran applied for disability benefits, the VA denied her, saying knee pain produced no true impairment, no disability. And under the law, the VA awards benefits for disabilities, not injuries. But just recently, in a historic turn of events, the Federal Circuit Court ruled that this veteran indeed qualified for disability benefits for knee pain. The court stated that, quote, disability, unquote, is defined as, quote again, an impairment in the enjoyment of life or earning ability, unquote. It opined that pain is a form of functional impairment, meaning that pain in itself is a disability regardless of any diagnosed injury. The court reasoned that if the VA awards veterans with Gulf War syndrome benefits for, quote, undiagnosed illnesses, unquote, veterans suffering from chronic pain with no specific diagnosis should also be eligible for compensation. The new ruling could finally mean undiagnosed veterans suffering from chronic pain will obtain their well-deserved VA benefits. Likewise, many veterans who suffer from chronic pain develop residual psychiatric disabilities. The new ruling could allow for secondary service connection for veterans who suffer from depression or anxiety associated with their chronic pain. If you're a veteran suffering from chronic pain and have been denied VA benefits in the past, you may now be eligible. Contact Telemedica LLC at telemedicallc.com and or the contact number on the website and soon to be published, 512-883-8446. Again, this is Dr. Mark Freeman, the new medical director for Telemedica. Our topic of discussion this month was patellofemoral pain syndrome. Hopefully you got something out of this. You've learned a little bit and know that there's always hope for, even if you were denied for chronic disabling pain in particular locations. If you have any questions, I'll be able to answer some of your questions now. I'll entertain a Q&A. If there's any questions, let me know. I'll await the first question. How do I get started with Telemedica? Well, the first thing to do is visit their website at telemedicallc.com and or call that number that we just gave you. Again, that number was 512-883-8446. You can also do customer service at telemedicallc.com. Any other questions? I'll wait just a little longer for a few questions. I have some questions that came up just a minute ago, and one of those questions: what medical evidence does Telemedica require to get started with the med team? Well, to get started, Telemedica's services they required ED-214 to denote your dates of service, your area of service, your MOS, and some of the awards you might have been given. It gives it's helpful for us to have a copy of your benefit summary, your proof of your current diagnosis of a medical condition. Recommended documentation might include your blue button report, personal statements, buddy letters, medical records, or anything that is relevant to your contention. Any other questions? Anything specifically pertaining to patellofemoral pain syndrome? One of the questions that arose was more of a generalized question. What makes Telemedica services different from other medical evidence services? That's a good question. Well, unlike some independent provider services, Telemedica is an administrative company that pairs you with a licensed provider that fits your unique needs. We have a customer service team that's unparalleled and will help you through every step of the process. Additionally, many of our providers are veterans themselves and therefore understand the process. We provide medical evidence in the form of mental health evals, nexus letters, recurring therapy for veterans, and a variety of specialty medical documents. Make sure that you let Telemedica help you get the VA benefits you deserve. Any other questions? Okay, again, there is a question. Another question: is there a way to upload info for your services? Absolutely. And I would think that you would get in touch with customer service at telemedica.com and or call that number on your screen, 512-883-8446, and they can help you with the process to upload your documents for their review. That's a great question. Any other questions? Okay. Again, I'm Dr. Mark Freeman, the new medical director for Telemedica, as well as the medical director for Access Medical Solutions, where Telemedica is an expert in the MHA, or mental health assessments. We at Access Medical Solutions are experts in the physical health assessments. We collaborate with Telemedica, and as far as providing you a total package, if you will. So before I sign off, I'm going to ask one more time, any other questions that we can answer live at this time? Got a question from Mr. Price. His name: can pain in the knee come and go? I noticed during long walks, my knee starts out okay, but later it becomes painful to even continue. The answer, James, by the way, that's a good question. That's one of the I don't want to say diagnostics, but one of the manifestations of the condition of pain in the patellofemoral area is that it usually is due to an inflammatory process that's due to increased weight bearing or stress and strain in that area under the kneecap in the front of the knee joint. And yes, if you could start out fine at one point in time, and then because of wear and tear or use and abuse or increased stress at that joint that is not strong in the first place, it can start out with some pain. I mean, it can start out normally and then wind up with some pain. The conventional therapeutic approach to such is that you would take some sort of non-steroidal anti-inflammatory prior to stressing, and then maybe after your run as well. Everybody knows the acronym RICE, but it's a reactive approach to therapy, and RICE is rest, ice, compression, and elevation. As a preventive medicine physician, we'd rather that you be proactive and do those recommended stretches, strengthening, losing of some weight, and increasing your ability to prevent what could happen. But if it does happen, start out with a little stretching and an anti-inflammatory before you go, and then make sure that if it does occur, take an anti-inflammatory and do that RICE acronym: rest, ice, compression, and elevation. Great question, James. Anything else before anything else? Okay. Oh, one more question. Excuse me, just at the last minute. Mr. Goose, is there any association between hypertension, chronic kidney disease, stage 3? Does hypertension cause chronic kidney disease and gout, or vice versa? Well, a little bit off topic. I would rather have fielded a question more pertaining to patellofemoral syndrome, but if I can do it in briefly, let me just say that hypertension can affect the kidneys in different ways, and vice versa. The kidneys can affect the blood pressure in different ways, and it depends on if you have primary or secondary hypertension, and if you developed hypertension before the kidneys. If you got chronic kidney disease stage 3, it looks like you've got a pretty significant impairment, and that certainly can affect your blood pressure as well. Does hypertension cause kidney disease and or gout? Gout is an arthritic condition due to the formation of uric acid crystals and being deposited in joints. Usually the smaller the joint, the more symptomatic you become. It can happen in many joints, but usually it starts out in the great toe or the ankles, but it can be affected. And uric acid can be controlled. You're either an overproducer of uric acid or an undersecretor of uric acid. And knowing that you have chronic kidney disease stage 3, it would seem that you are undersecretor. So that would be very important to watch your diet so that you're eating foods not so high in the purines that form uric acid. Uric acid is formed by a purine called uracil, and it would be more apropos for you to prevent any conditions of gouty arthritis by watching your consumption of purines. Okay, I think that's it. If there's no other questions, I'll end today's discussion. Know that next month, September 22nd, we'll have a live go at Meniere's and vertigo. It happens that National Balance Awareness Week is September 19th through 25th. And so on the 22nd, which falls right in the middle, we're going to talk about balance and awareness of the differences of imbalances, being vertigo from a positional standpoint or vertigo from a central standpoint, like Meniere's disease, inner ear disease. All right. Thank you for your attention. I hope you learned something today. As always, Telemedica is here to try to inform you with conditions relative to our veteran community. And if there's anything else we could do for you, please don't hesitate to contact us at our website, at our email, at our phone number. Thank you. Have a good day.